Is myasthenia gravis a neuromuscular disease? Yes. What can a traumatic lumbar puncture result in? Xanthochromia, right? A high RBC count. Sorry, without xanthochromia. A traumatic lumbar puncture can result in a high RBC count without xanthochromia. Note that you should not accept biased slides or information from corporations or industry types. What sort of study should you do if you suspect your patient has gastroparesis? Do a nuclear gastric emptying study if you suspect gastroparesis. A CABG is preferred over percutaneous coronary intervention due to a lower rate of all-cause mortality. What sort of vascular anomalies are associated with end-stage renal disease? Angiodysplasias, such as vascular ectasias or arteriovenous malformations, are associated with end-stage renal disease. Stress hyperglycemia is a potential complication of sepsis, so beware if you have a septic patient, look out for stress hyperglycemia. Nephropathy-associated analgesic is associated with florid nephrotic range proteinuria. If you have a child in your clinic that has had a febrile seizure, what's most likely to happen again? Another febrile seizure. So just provide reassurance, okay? If systemic issues occur in a healthcare setting, what sort of analysis should you do? A root cause analysis. What is the most common cause of cellulitis? Streptococcus pyogenes, also known as Staphylococcus aureus. That's the most common cause of an abscess. The most common cause of cellulitis is Streptococcus pyogenes. The most common cause of abscess is Staphylococcus aureus or Staph aureus. Note, when you're dealing with patients, you should understand their frustrations, so say it if it's necessary. I understand your frustrations. Empathize with them, get the information that you need to give great healthcare. What genetic issue is male breast cancer commonly associated with? BRCA mutations, right? As well as Klinefelter syndrome. Male breast cancer is commonly associated with Klinefelter syndrome and BRCA mutations. If an epileptic patient on a medication doesn't take their medications, what are they at risk of getting? Seizures, yep. What sort of organism lives in fishy H2O that can cause many problems with your skin and liver? VV, Vibrio volnificans, or Vibrio volnificus. If you do an arthrocentesis and it shows monosodium urate crystals that are negatively birefringent and needle-shaped, what does that confirm? Gout, right? What's the first-line treatment for acute gout? NSAIDs like indomethacin, barring any sort of contraindications, of course. A bronchoprovocation test is used to test for what? Exercise-induced asthma. A bronchoprovocation test is used to test for exercise-induced asthma. How is trichomonas treated? With metronidazole. So partners should get treated too, okay? Oral terbinafine is used to treat severe tinea pedis. Is that true or false? It's true. How do you treat severe tinea pedis? Oral terbinafine. In skewed distributions, is the median a more is the median a more valid measure of central tendency than the mean? Yep. In a skewed distribution, the median is a more valid measure of central tendency than the mean. Note that there is a minimal risk of adrenal insufficiency. There is minimal risk of adrenal insufficiency in stopping a steroid use only if a person's been like using it for like 3 weeks for the most part. So go ahead and stop it. How would you conservatively manage varicose veins? Compression stockings and elevation. If you see a patient with a heliotrope rash or Gottron's papules, what should you suspect? Dermatomyositis. And what serology would you test for? Well, yeah, serology for antibody testing, right? What condition that can severely affect health is dermatomyositis associated with? Malignancy. In general, how do you treat Graves' disease? Treat Graves' disease with a beta blocker, an anti-thyroid medication, or even surgically removing the thyroid. Also note that you should monitor T3 and T4 levels in your patient that has Graves' disease. And for hypothyroidism in pregnancy, what should you do? Increase the levothyroxine and check the TSH in 1 month. In a patient with hypothyroidism, what should you get? You should get a TSH. Patients with mixed cryoglobulinemia syndrome have elevated rheumatoid factor and hypocomplementemia and renal insufficiency and palpable purpura. So beware of that mixed cryoglobulinemia syndrome. What syndrome is associated with elevated rheumatoid factor, hypocomplementemia, renal insufficiency, and palpable purpura? It would be cryoglobulinemia syndrome. How do you treat mixed cryoglobulinemia? Treat it with immunosuppressive therapy. So, a person with a known cause for DVT needs anticoagulation for how long? 3 months. How is molluscum contagiosum transmitted? Via skin to skin contact. What issue that you should check with an ophthalmoscope do obese patients tend to get? Obese females tend to get pseudotumor cerebri. If your elderly patient is having worsening memory, what levels should be checked in their blood? Folate, right? Among other things, but folate commonly pops up. If a drunk person in the ER wants to kill themselves, what should you do? You should observe them in the ER and reevaluate. If you have a patient with a history of an intentional drug overdose or a previous suicide attempt, should you heavily screen them for suicide if they're in the ER? Definitely. In general, what is the threshold for a blood transfusion in a normal person without any medical conditions? 7 milligrams per deciliter. What about if it's in someone with a very sick patient? 8 milligrams, right? So if they're very sick or have some obvious issue, it's 8 milligrams per deciliter is the threshold for blood transfusion. Do patients with Turner syndrome typically have low IQs? Nope. Patients with Turner syndrome typically have normal IQs. And regarding that, Turner syndrome, it's not necessarily inherited in an autosomal dominant or autosomal recessive pattern. So a patient if the parents are wondering if they have another kid, will they have Turner syndrome again? The likelihood is that of the general population that they will, or if anything, slightly a little bit higher chance, but not in the typical Mendelian traits way. All right.